Good morning students. Today we will discuss the university questions, reasoning out questions. So the first question is, why is the second heart sound normally shorter and higher pitch than the first heart sound? You know, second heart sound is due to the closure of semilunar valves and first heart sound is due to the closure of atrioventricular valves. Here the atrioventricular valves will be larger and the vibrations produced by them will be less compared to the semilunar valves, which are smaller and they produce high frequency vibration. That is why when they close, they produces louder sound. Okay, because of the valve structure, they produces the louder sound. They produce high frequency vibration due to the valve structure. The next question is, why the coronary blood flow to the left ventricle predominantly a diastolic phenomenon? See, in systole, when the muscles are contracting, the blood vessels between the muscles are squeezed, so blood flow is not going to the cardiac muscle as such. But during relaxation, the blood vessels are not squeezed and dilated, so the blood flow will be more during diastole. So the left ventricular muscle relaxes and the intramyocardial vessels are no longer compressed. So you have a good blood flow during diastole. Why do fingertips exhibit greater tactile sensitivity than the skin over the back? So because if you see, there is a structure, there is a concept called homunculus. Homunculus is the representation areas of the various body parts in the motor and sensory cortex. So there is a larger representation for fingertips, especially for the thumb, in the somatosensory cortex. Also, there are more receptors, touch receptors located in the fingertips. These are the two reasons why the tactile sensitivity is more in the fingertips compared to the back. See in this picture, if you see, this is the sensory homunculus where the areas of various parts are represented, and this is a sensory cortex and this one is a motor cortex. You can see that thumb will have more area of representation compared to the back. Back have very less area for representation, whereas for the thumb you have more area for representation. Even for lips, if you can see the lips, it has a wider area of representation compared to in the entire face. Lips have wider area of representation, where the tactile sensitivity or the 2-point discrimination will be more. Compared next is the physiology base of Rennie's and Weber's test in conductive hearing loss. Rennie's test compares the air conduction and bone conduction. Usually air conduction is the conduction of sound through the ear, external ear and middle ear, and any problem in this middle ear or the external ear that causes conductive hearing loss, where the Rennie's test will be affected. The air conduction will be affected, so it will be less than the bone conduction. Bone conduction is the conduction of the sound through the mastoid directly to the inner ear. So in Rennie's test, the air conduction is compared with bone conduction. It is, if it is normal ear, air conduction is greater than bone conduction. That is, conduction through middle ear is best. In conductive hearing loss, where there is a pathology in the external middle ear, the air conduction is affected, so bone conduction is greater than the air conduction, which is taken as Rennie's negative. Weber's test is comparing the bone conduction to both the ears. If a ear is having conductive hearing loss, in that ear the external sound influence will be lost. So when you do bone conduction, it will be louder in the affected ear. So the sound will be heard more in Weber's test in the affected ear, the ear with conductive hearing loss, it will be heard more. So in conductive deafness, the sound is lateralized to the affected ear because environmental sounds are reduced in that ear, and bone conducted sound will be perceived very louder. So this is a Weber's test where we are conducting the bone conduction on both the ears, whereas Rinne's test we are comparing air conduction and bone conduction. Air conduction is something conducting through the external and middle ear, then goes to the inner ear. Whereas bone conduction is you are directly pressing to the mastoid, and from the bone it connected to the cochlea. So, in conductive deafness, which is a pathology in the external middle ear, the air conduction will be affected. So what is the physiological basis of decerebrate rigidity? So decerebrate rigidity is an experimental procedure done to demonstrate the influence of the higher center over the pontine and the vestibular nucleus. So the brainstem is transected between the superior and inferior colliculus. So the red nucleus influence and the cortical influence, inhibitory influence will be stopped. So the pontine reticulospinal tract and vestibulospinal tract are excited because they lost the inhibitory influence from the red nucleus, and these two tract supplies the extensor muscles especially. So they get excited, the pontine reticulospinal and the vestibulospinal, so they stimulate the extensor muscles. There will be excessive activity of extensor muscles leading to extension of upper and lower limb with plantar flexion of the feet. See here, there is a nucleus here. This here is a between the superior and inferior colliculus in the midbrain lesion is there. So the red nucleus influence over the vestibular nucleus is lost. So vestibulospinal will get activated. Similarly, the red nucleus inhibitory influence is lost over the pontine reticulospinal tract. So pontine reticulospinal also gets activated, and the pontine and vestibular both stimulate the extensors, and the extensor activity will get high, increased. So the arm is held in extension and the legs are also held in extension with plantar flexion. So this is the inhibitory influence from the red nucleus over the vestibular nucleus is lost. So vestibular nucleus is more excited. So these are the questions asked as reasoning out questions in your actually this was in the second paper, I think. Yes.